This is the recording on training on how to input notes, especially the exam notes for our medical assistants using Advanced MD application on an iPad. The icon at the bottom of the screen is the Advanced MD app. You'll click it, open it up, and you'll enter your unique name and password using the office key of 130263, unique to the Plano location. Username on this one I'm going to use as a test, and the password, and a pin will come up. The pin is just for the momentary use of the system, so you can walk away, it'll lock, and you can open it back up, just to keep people from entering your note if you walk away from it. So it's unique, it can change as much as you want, but you just verify it. Now it's going to come open to the Case Manager, Exam Room, and Exam Room 2 schedule. Now you can change that by clicking on the top right, Medical, the medical rooms, A through E, F through R, and P through Z is this example that changes frequently based on the therapist's first name. But of course you'll want to be in the medical for this, and you can also add and take away rooms if you don't want other people on it. So for example, there's some appointments on the schedule today. What you want to do to activate and start a treatment or a inputting notes, you click on the patient here, and it'll be in blue, and it tells you it's a day 2 initial exam. Have the patient's information. Sometimes it has memos as well as a picture. But what you want to do to start the note, you'll click on the note middle part here. It has the top 3 middle pluses here. The middle one will begin the note area. Now to access other patient information, you'll click here and you'll go into specifics with the patient, past history, and so forth. There's the notes area that has their specific phase and protocol as well as additional notes. You'll have history of scheduled appointments, health risks, and so on. Get familiar with these, as well as the notes area, which will also bring open all the past notes that have been on the patient, so you can reference what's been done in the past. But to go to a note, an exam, an initial trigger point exam, an office visit general note, and there's a TPI series. There are more note templates being added, but the exam note is going to be your typical go-to. It's going to be an initial exam or re-exam or exit exam or reactivation exam, but exam is all-encompassing. You'll click on that, and it will begin with just the general information. You can input your CPTs and your ICD-9 codes now, if you already have those, by entering those by pressing on that bottom right $+ area, and this will bring open the procedures and diagnosis area. You can change by going through them. You can click on the procedure to open up to find more, close it, collapse it, open up the diagnosis by clicking on the gray area. But you can also go up to the upper right, and the standard is just like all of those typical ICD-9 and CPT codes. But if you want to find specific for exams, you click on exams here, and it'll bring open to the far left all the typical exam codes that we use, as well as the typical diagnosis that we use here as well. And of course, you can always search in your own and try to find codes and all that. So, for example, we'll click on a new evaluation, and it'll load right in there. And then you can click on the attributing diagnosis on whatever works there and hit done. And then you want to say submit for billing or save for later. You can always submit. In this case, we're going to save for later. But submitting for billing is kind of the next step. We'll go into the claim submission box and get reviewed and make sure everything goes well for the billing team. But we'll save that for later. And you'll want to go back into the note. Now to go back in a note, you'll close out on the top left, and those should be input into there. To begin the history and information, history of present illness and medical evaluation, you'll see that the beginning says this is a current patient for a re-exam. Now that's the default, but really you want to change that to a new patient exam. And the patient experiences the following symptoms. Now you can click on the box and type in your own things, or you can click on the tilde there and describe how they felt and so forth. And then pain scale, of course, 0 to 10, 10 being the worst, how frequent, and then what areas they feel a discomfort. The first one is the posterior, the anterior, left, right, and so on. If there's no discomfort, click no discomfort and move on. It may just be their anterior shoulders. It may just be their right or left shoulder. It may just be their right thigh and so forth, or it could be none. Fill that out because each one of these yellow indicated areas, which is pretty much everything, are required notes to be input. It will not allow you to save unless you put something in those notes, even if it's nothing or no symptoms. When did it begin? You can always keep it on this data service because it's the first time that they've started, or you can go back to a specific date. They say they feel better with massage. They feel worse with bending and twisting and driving. And the contributing factors are computer work and overactivity. And of course, you reviewed the intake. You've done all that, past family, social, and the physical evaluation. You want to check these as they go through the areas that, of course, have been checked during our physical and medical evaluation. Additional exam findings here, you can tap and enter anything specific, any scarring and additional information. And here are the vitals. So you have the 120 over 80 with 72 beats per minute and let's say 10 respirations. Weighed in at 180 and they were 5'9". Simple as that. Then you go on to the physical medicine evaluation exam at the top. Click on that. And this will go through your range of motions and orthopedics. Now, they're going to default as normal. Now, if they're not normal, of course, change them. Let's say flexion was normal, extension was restricted. And then right rotation restricted with pain, and everything else was normal. Then what orthopedic tests were performed that found to be positive? Now, these are positive. That means they had some clinical significance. Say that there was a left and right shoulder depression and a positive Valsalva's. Now, if you want extra, you just put in here and you can add it. Once again, other positives, you can always tap and add it in if you found those. And which ones were found to be negative? Well, the ones that were performed that were negative, that had no clinical significance, put there. Lumbar range of motions as well as orthopedics, same thing. Severely restricted. And let's say that the Patrick Verbeers were found innocuous, and then the negatives were those. Now, which muscles were found to be severe, found to be moderate, found to be mild, and found to be normal? Now, severe, you can say none, all of them. You can keep it blank. You can also say the upper trapezius were moderate, mild were the pec major, minors, these guys in here. And then what were normal? Well, the TFL and the piriformis were normal there as well. Now notice these are gray, which means they're not required technically for the exam code that we're performing. This is more for clinical diagnosis to find out what category of care they're in. But we go above and beyond the normal exam because we're in physical medicine, not just the medical world. Now when you have that, treatment orders are next. Now, the objective goals we wish to accomplish, basically, increase range of motion, basically to those regions that we found, depending on the protocol. Now, if there's upper, lower cross, and the shoulder girdles, and so forth, what objective goals? Increase muscle strength and endurance in those as well. What are the long-term treatment goals? Include improve posture, become more active, sit, stand longer. And you can always add more that you see. Maybe they want to hold their granddaughter or something like to that effect. Manual therapy, we're going to start 3 units there, 1 unit for the active. That means phase 1. And the following durable medical equipment are used. You can say none, or you can add what you recommend or what the provider recommends there. And then at-home rehab equipment, additional products. You say there's other healthcare things like TPI, inarticular. We talked about prescriptions and so forth. And then what other, if there's any referrals, do we say, we really need to go see a cardiologist for that heart stuff? or no or recommended at this time. Now, that default's there, but you'll have to delete that if there's something recommended, but it will default because half the time we kind of wait to see how they do before we refer them out. The reference or the frequency of care, the care plan, you always start with this one. This one's yellow, so you at least have to put some frequency. And PRN means per requisite need. Basically, they are a wellness patient. So you want to change that. Let's say they're 2 times a week for 4 weeks, and then we want to move to 1 time a week, and then we want to do every other week for 2 months, and then PRN from there. There's supposed to be reevaluations at the end and some range of motions done as well. Total number of visits estimated is 18 for this plan, and then any other additional information and things you want to add, additional notes you can add there. And that's the sum of the usual evaluation. Now, if you need to add additional notes, you go to the subnote on the top right corner. This subnote will allow you to input additional exit care exam notes, additional exam items, protocols, which is more for the PNMR treatments, but additional exam items are shoulder and knee exam that we don't do with everybody. That's additional, as well as reviewed and signed off. Now, we won't always use the reviewed and signed off because technically that's going to be reviewed at the end of the day anyways and signed off by the person that's logged in and used their sign-off key. So that's just an additional thing if we need that. But that's going to be everything. What you'll do is you will save that note. You will not sign it because it then goes to the review bin located at the bottom to be reviewed and sent off. Here we see that a note was created for your patient at the very top, and then the provider will go in, click the signed button, and then sign off on it after reviewing. And that's how you input notes. Other than that, you'll need to know how to change and update the notes part here if they move to phase 1, phase 2 from phase 1, or their information changes. Maybe they want to be more firm or avoid new areas or additional notes there. That will be done on the PC, and I'll have to teach you that separately, as well as inputting the new Health Watcher information. Health Watcher is a way to track a patient's care, so we'll have to do that additional time as well. All right, that's it.